In the whirlwind of life, it's easy to dismiss the subtle whispers our bodies send us. Yet, sometimes, those whispers may be warning us of a silent invader, colon cancer. This is always called a silent killer, as it may not show the symptoms until the tumor is large and enough to cause problems. In the USA, it's estimated that over 100,000 cases are recorded per year. This insidious disease often lurks in the shadows, its symptoms masked by the routine aches and pains of daily existence. Colon cancer is a disease in which the cells of the large intestine become abnormal, as well as multiply unconditionally. Ignoring these early warning signs can have devastating consequences. But fear not, knowledge is power. And in this video, we unveil the 10 telltale signs that your body might be sending distress signals from within. So buckle up as we embark on a journey to unravel the mysteries of colon health. Your body is a temple, and it's time to decode its messages. Please ensure you subscribe to be part of the family. 10. Unexplained pain. Persistent abdominal pain or discomfort, especially if it intensifies over time, should never be brushed aside. It could be a sign that something is affecting the nerves or organs in your abdominal region. Colon cancer can cause pain as the tumor grows and exerts pressure on surrounding tissues. The pain may be intermittent or continuous and should be thoroughly evaluated by a healthcare professional. Consider the nature and location of the pain. Pain that persists or worsens over time, especially on the right side of the abdomen, may indicate issues with the ascending colon. Prompt evaluation and imaging studies are essential to determine the cause of the pain. Communicate openly with your healthcare provider about the characteristics of the pain and any factors that may alleviate or exacerbate it. Describing the characteristics of pain involves noting its intensity, duration, and any activities or positions that worsen or alleviate it. Communicate these details openly with your healthcare provider to guide further investigations and develop an effective pain management plan. 9. Changes in gas patterns. While occasional changes in gas patterns are normal, persistent shifts could be a subtle indicator of colon cancer. Pay attention to any unusual changes in the frequency or intensity of flatulence. Changes in gas patterns may occur as a result of alterations in the bacteria present in the colon due to the presence of the tumor. Moreover, these changes might be accompanied by a foul odor or discomfort. If you notice an increase in gas accompanied by an unusual smell, it could be an indication of changes in the bacterial composition of the colon. These changes may be linked to the presence of a tumor, necessitating further investigation. Keep a log of your dietary habits and any associated changes in gas patterns to share with your healthcare provider. Recognizing patterns in gas production involves considering dietary choices, food intolerances, and potential gastrointestinal issues. Transparent communication with your healthcare team facilitates a more accurate assessment of these patterns and aids in determining the most appropriate diagnostic steps. 8. Narrow stools. Also known as pencil-thin stools, this change in bowel appearance can be indicative of an obstruction in the colon. If your stools consistently appear narrower than usual, it's a signal to consult your healthcare provider. The narrowing of stools may result from the tumor partially blocking the colon, causing changes in the shape and size of the stool as it passes through. It's crucial to observe not only the width, but also the consistency of your stools. Persistent thin stools accompanied by changes in bowel habits should be thoroughly investigated to rule out potential colorectal issues. Providing detailed information about your bowel movements, including any discomfort or pain associated with the changes, will aid in the diagnostic process. Recognizing the importance of stool consistency involves assessing factors like fiber intake, hydration, and overall gut health. Discussing these aspects openly with your healthcare provider helps in crafting a comprehensive plan for managing and investigating changes in bowel habits. 7. Iron deficiency anemia. Colon cancer can lead to chronic bleeding, albeit in small amounts, which may go unnoticed. Over time, this can result in iron deficiency anemia, characterized by fatigue, weakness, and pale skin. Anemia occurs as a result of the body losing iron through the prolonged bleeding associated with colon cancer. Regular monitoring of iron levels is crucial for early detection and intervention. In addition to fatigue and weakness, be attentive to other symptoms of anemia, such as shortness of breath, dizziness, or headaches. These signs may indicate a significant drop in iron levels and should prompt swift medical attention. Discuss any concerning symptoms promptly with your healthcare provider to facilitate timely intervention. Recognizing the multifaceted nature of anemia involves considering contributing factors such as dietary intake of iron, vitamin B12, and folate. Communicating your dietary habits and any supplementation with your healthcare team helps in tailoring interventions for optimal results. 6. Incomplete bowel movements. If you frequently feel the need to pass stool but struggle to fully evacuate, it could signify a problem with your colon. This persistent feeling of incomplete bowel movements may be an early sign of a blockage or tumor. The tumor may narrow the passageway within the colon, making it challenging for stool to pass through completely. Consider the consistency of your stool as well. If you notice persistent loose or watery stools, it could be a result of the tumor's impact on the colon's ability to absorb water, leading to diarrhea. Maintaining a daily bowel movement diary can aid in tracking changes and providing valuable information to your healthcare team. Exploring factors that contribute to incomplete bowel movements, such as dietary habits, stress, and hydration, can assist in devising strategies to alleviate symptoms. Discussing these details openly with your healthcare provider promotes a more comprehensive understanding of your gastrointestinal health. 5. Abdominal discomfort or cramps. Chronic abdominal discomfort, cramps, or bloating might be dismissed as indigestion, but when these symptoms linger, they could be indicative of an underlying issue like colon cancer. The tumor's presence can lead to obstruction or changes in the normal functioning of the colon, causing persistent discomfort in the abdominal region. Pay attention to the location and nature of the discomfort. While occasional cramps are normal, persistent pain, especially on the left side of the abdomen, may warrant investigation. Additionally, abdominal bloating that doesn't subside with changes in diet or lifestyle should be carefully evaluated. Record the intensity and duration of these symptoms to provide detailed information to your healthcare provider. Describing the characteristics of abdominal discomfort, such as sharp or dull pain, intermittent or constant, and any associated factors, assists in narrowing down potential causes and guiding diagnostic tests. 4. Persistent fatigue. Feeling tired all the time, despite adequate rest, could be your body's way of telling you that it's fighting something more than just the daily grind. Colon cancer can cause fatigue due to the energy demands of the growing tumor. Additionally, the chronic loss of blood through the gastrointestinal tract can contribute to anemia, further exacerbating feelings of tiredness and weakness. Consider the quality of your sleep as well. If you're experiencing fatigue despite maintaining a regular sleep schedule, it's essential to delve deeper into the potential underlying causes, including the possibility of colon cancer. Implementing relaxation techniques and ensuring a healthy sleep environment may contribute to better overall well-being. Assessing the impact of fatigue on your daily activities and overall quality of life provides valuable information for your healthcare provider. Documenting when fatigue is most pronounced and any factors that alleviate or worsen, it can aid in developing a tailored intervention plan. 3. Unexplained weight loss. Shedding pounds without an apparent cause might seem like a blessing, but it can also be a warning sign. Unexplained weight loss, especially if rapid, could be a signal that something is amiss within your body, including potential colon cancer. The tumor's growth can lead to a decreased appetite and changes in the way your body absorbs nutrients, resulting in unintentional weight loss. Keep a close eye on any changes in your eating habits. Loss of appetite, aversion to certain foods, or difficulty swallowing may accompany weight loss and could indicate issues within the digestive system, prompting the need for thorough investigation. Maintain a food diary to help identify patterns and discuss these observations with your healthcare provider. Understanding the context of weight loss involves exploring lifestyle factors, stressors, and potential emotional or psychological contributors. Communicating these details with your healthcare team can assist in formulating a comprehensive assessment. 2. Blood in stool. Blood in the stool is a red flag that should never be ignored. Whether it's visible blood or a darker, tarry appearance, it could indicate bleeding somewhere in the digestive tract, warranting immediate attention. The blood may be bright red or maroon, suggesting bleeding in the lower digestive tract, possibly from the colon or rectum. In some cases, the blood might not be visible, but tests may reveal its presence, emphasizing the importance of regular screenings. Consider the frequency of the bleeding. Occasional bleeding might be attributed to hemorrhoids, but persistent or recurrent bleeding could signal a more serious underlying issue, including colorectal concerns. Documenting when you observe blood in your stool can help your healthcare provider assess the urgency of the situation. Recognizing the potential causes of blood in the stool, such as hemorrhoids, ulcers, or diverticulitis, can guide your discussions with the healthcare team, facilitating a more targeted diagnostic approach. 1. Persistent changes in bowel habits. Your body has its language, and changes in bowel habits often speak volumes. If you notice persistent alterations in the frequency, consistency, or size of your bowel movements, it's time to pay attention. A sudden increase in constipation or diarrhea that lasts for more than a few days could be an early indicator of colon cancer. This change may be due to the tumor affecting the normal functioning of the colon. Furthermore, pay attention to any changes in the color of your stool. While variations are normal, persistent pale or clay-colored stools could indicate a potential blockage in the bile ducts, possibly linked to colon cancer. Keep track of these changes, as they can provide valuable information to your healthcare provider during the diagnostic process. Understanding the nuances of your bowel habits involves observing not only the frequency, but also the urgency and discomfort associated with each bowel movement. Any marked deviation from your usual patterns warrants closer scrutiny. Heeding these warning signs is crucial for early detection and successful treatment of colon cancer. Regular screenings, including colonoscopies, are vital for catching abnormalities before they escalate. A colonoscopy is a procedure that allows your doctor to examine the inside of your colon. Colonoscopies are used to detect and treat problems in the colon, such as polyps, ulcers, and cancerous tumor. Adopting a healthy lifestyle with a fiber-rich diet, exercise, and proper hydration promotes colon health and reduces the risk of colorectal issues. Our bodies communicate in mysterious ways. Paying attention to these signals can significantly impact well-being. Prioritize your health, like, comment, and subscribe to stay informed about your body's signals. Thank you for joining us on this health journey. Your well-being is paramount.